Hello, I am Dr. Chandrasekhar, consultant neurologist at Care Hospital, Mushirabad. Today I am going to discuss briefly about the brain stroke. I am going to discuss brain stroke in the following manner. What is brain stroke? What are the causes of brain stroke? How to diagnose brain stroke? How to treat the brain stroke and how to prevent the brain stroke. What is brain stroke? Brain stroke is a sudden focal neurological deficit due to compromise of the blood supply to the particular part of the brain. The brain stroke is divided into two types: ischemic brain stroke and hemorrhagic brain stroke. Ischemic brain stroke is due to loss of blood supply to the particular part of the brain occurs. In hemorrhagic brain stroke, the blood comes from the blood vessels. It will call as the hemorrhagic stroke. What are the symptoms of the brain stroke? Brain stroke patients will present as the focal neurological deficits. Either one side of the body is paralyzed, that is upper limb and lower limb weakness, associated with difficulty in speaking, or sometimes with deviation of mouth to one side, or dysphagia and dysarthria. These are the symptoms of the brain stroke. What are the causes of the brain stroke? The main risk factors for the brain stroke are the hypertension, diabetes, hyperlipidemia, alcohol consumption and cigarette smoking, and any other heart related diseases like myocardial infarction and valvular heart disease. How to diagnose the brain stroke? The brain stroke is mainly diagnosed by the clinical symptoms like one side of the body paralysis, difficulty in speech, deviation of mouth, loss of consciousness, seizures. What are the tests to be done for the brain stroke patients is mainly MRI brain and CT scan. Based on the CT scan and MRI stroke, we can characterize the type of brain stroke, either it is ischemic stroke or hemorrhagic stroke. How to treat the brain stroke? If the patient presents within the 4.5 hours of the brain stroke symptoms onset, we can thrombolize the patient with the IV thrombolysis, that is by the arteplase or tenecteplase injection. If the patient receives this thrombolysis injection, they will have the good response in the future outcome. If the patient presents with the hemorrhagic stroke, we have to control the BP, we have to control the blood pressure, and we have to control the edema which is formed due to the edema. If requires, we have to go for the surgery. How to prevent the brain stroke in the future is to using the antiplatelet drugs like ecosprin, clopidogrel, and controlling the BP and controlling the diabetes and controlling the cigarette smoking and alcohol. We can prevent the brain stroke in the future. In hemorrhagic stroke, we have to rule out for the hypertension or any other vascular anomalies like aneurysms, AV malformations. We have to rule out these malformations based on the CT scanning and MRI scanning. What are the other supportive measures that to be given to the stroke patients? The patients who presents with the ischemic stroke or hemorrhagic stroke, they will have the long-lasting limb weakness, either leg or hand weakness or difficulty in speech. For these patients, we have to give the intensive physiotherapy and occupational therapy as a speech therapy. We have to take care of the patients by giving the exercise to the patient and the speech therapy to the patients. In the future, we have to monitor the patients for every 3 months for controlling the hypertension, diabetes, and prevention of the further stroke.